Hey y'all, I'm Gwen from Down Home.
And I'm Gayle, also from Down Home. I run our statewide campaign to expand Medicaid.
That's why we asked you to be here today because we've got questions about Medicaid. I've got questions about Medicaid expansion. So, first of all, could we just start with you telling us exactly what is Medicaid expansion and what that means?
Sure. So the way that Medicaid works in North Carolina right now, there are some pretty intense limitations on who actually qualifies for Medicaid coverage. So that means that we have more than 680,000 North Carolinians who don't qualify for Medicaid, but also don't earn enough to get private insurance on the marketplace. And Medicaid expansion would make those North Carolinians eligible for Medicaid. And it's something I think we should do pretty urgently. We are one of only 12 states in the country who has still not expanded Medicaid.
Yeah, thank you. I am a single mom and I've lived in the Medicaid gap or the coverage gap for years of my life. So definitely understand and definitely know that it's a problem in North Carolina. Could you tell us where we are in the fight right now? What's going on with Medicaid expansion?
Yes. So big picture, recently, our federal government passed a COVID relief package that had pretty sweet incentive for states like North Carolina to expand Medicaid. If we expand Medicaid, that would make us eligible for $1.7 billion in federal funds to come into our state and help cover the cost of healthcare. And, you know, we have been trying to expand Medicaid in the state for years. It was one of the reasons that Governor Cooper vetoed the budget last year. So now, again, we are picking up that Medicaid expansion fight, hoping that this new federal incentive will actually get it through.
That sounds really big. Are there any bills or is there anything moving on that legislatively right now?
There is. So there are a couple of bills that I am a really big fan of, and then there's a little bit of movement that I don't love. So I'll start with the two bills that I think are really great. The first is a House bill. It's House Bill 470, and it is a bill for full Medicaid expansion. This was filed just a week ago on March 31st. It has 41 sponsors, including Representative Ricky Hurtado, and it talks a lot about the impact of COVID, people losing employer-sponsored health insurance, our essential workers not getting health care. There was a quote in there that I really liked that said, "Many workers perform essential but unrecognized services in our communities in positions without affordable employer-based healthcare insurance." And so providing Medicaid coverage for all North Carolinians with incomes up to 133% of the federal poverty level, which this is what Medicaid expansion is, it would increase access to quality health care. It would allow the state to draw down millions of federal funds to cover 90% of the cost of expansion. And then something that's really neat is that a hospital provider assessment will pay for the additional 10% state share. So the cost of the program is nothing for the state of North Carolina. The other bill that brings me a lot of hope is kind of a companion bill in the Senate. It's Senate Bill 402. And this is also a bill to close the Medicaid coverage gap. It was filed the day before the House bill, so on March 30th. It has 20 sponsors in the Senate. And this one really gets straight to the point of what they want, which is benefits provided to qualified individuals in the Medicaid coverage gap. So in order to be a qualified individual, there's a series of requirements, and you'd have to meet them all. So the person has to have a modified adjusted gross income that is at or below 133% of the federal poverty level. They need to be between the ages of 19 and 65. They cannot be entitled to or enrolled in some specific Medicare benefits that I won't go too into the details because honestly, it's a little wonky. And then they have to be like not otherwise eligible for Medicaid coverage under the North Carolina state plan as of January 1st, 2020. So the House bill, I think, really gets into a lot of the values that we share, the reasons for why we need to expand Medicaid, and then does define what Medicaid expansion would be. And then the Senate bill is a little more to the point. Here's what Medicaid expansion is, and we need it.
Those sound like some good things moving, but you mentioned that there was a not so hot one too?
Yes. So on the horizon is a potentially bad bill. Senator Corbin said in a town hall just last week that he will be filing a bill that would expand access to healthcare. And he used terms like partial Medicaid expansion. So let's not be confused here. The partial expansion that Senator Corbin is talking about is not only not the solution, it is specifically not Medicaid expansion. Because it's not Medicaid expansion, it leaves federal money on the table. That money that would cover the 90% cost of expansion and bring in the additional $1.7 billion into our state. With Senator Corbin's partial expansion, we get nothing. I think something that's really interesting is that there's such massive public support for Medicaid expansion. And so it confuses me why Senator Corbin doesn't believe that we can pass full expansion. There was a statewide poll done that said 64% of Republicans, 76% of unaffiliated voters, and 83% of Democrats support closing the Medicaid gap. So Senator Corbin says he doesn't think there's the votes in the House or the Senate to get that. And it just makes me question why, and it leaves a really bad taste in my mouth. Right now, rural North Carolinians are dying and need health insurance. This is not a political game. This is our lives. And we need Senator Corbin to fight for Medicaid expansion, something that he has vocally supported for years, instead of this partial Medicaid expansion that he's been talking about.
Wow. So to recap, hundreds of thousands of North Carolinians live in a healthcare gap during a pandemic and can't go to the doctors.
Yes.
We have the opportunity from the federal government that if we expand Medicaid like the vast majority of the states have, that we could get money that would fund it. So how can people get involved?
Yeah, so folks should join Down Home's healthcare campaign. We will be organizing around these two bills that I talked about, the ones we really like, but we'll also be doing some organizing around the budget because Governor Cooper agrees with us. It's time we expand Medicaid. And so our healthcare working group meets every Thursday evening at 5:30 p.m. It's really easy to sign up to join. I will make sure we include the Mobilize link at the bottom of this post. And we welcome all new folks to come in and get involved.
Well, thank you for your work on this, Gayle. Thanks for explaining to us. We are so glad to have you and the vast majority of North Carolina in our corner on this fight. It means a lot to families like mine. So thank you.
Thank you.